KIF Health Treatment Undertaking Services presents to you 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 Undertaking Services presents to you Health Treatment Undertaking Services presents to you
Good evening. On behalf of the Chief Health Treatment Undertaking Services and Professor Aisha Al-Dahiri, the Chair of Nutrition and Health Symposium webinar series, we are pleased to welcome you all to NHS 2020 in collaboration with Emirates Nutrition Association. Each series will be accredited by Department of Health Abu Dhabi with not less than 1.5 CME hours. We would like to take this opportunity to thank our NHS partners. SpecBright Group collaborated with the first webinar series last Thursday. Abbott Laboratories SA, our sponsor for today's webinar. Nestle Health Science, which will be conducted on 31st of October, and Tatkif that will sponsor the last series around November of this year. Once again, we thank everyone, our collaborators, our speaker, and attendees. We look forward that all will have a great time and informative lecture outcome throughout the NHS webinar series. Before we proceed with our webinar for today, please be reminded that our course attendance is being monitored for the number of minutes you are connected to calculate the CME hours you will be receiving. Once we have gathered and finalized all attendees' minutes of attendance, you will receive an email from us next week with 2 links for post-test and evaluation as a prerequisite of DOH. For those who will complete both links, we will send within 10 working days the copy of your PDF certificate along with the presentation of the course. Please note that the online post-test and evaluation portal will only be open for 1 month from the date of the course. Make sure that for those who are able to attend to fill out both forms to get your certificate. We would like also to invite everyone to follow, like, subscribe our social media accounts, Facebook, Twitter, Instagram, LinkedIn, and YouTube under Tatkif Health Treatment Undertaking Services to receive the announcement of our upcoming courses as well as view the recorded previous sessions. With that, for those who are unable to join today, we are simultaneously live through our YouTube and Facebook account, which will be open for a few weeks. We would like also to request our attendees to please type your questions, comments, or clarifications in the Q&A box down your screen, which we will address at the end of the lecture. Without further ado, we are pleased to introduce to you our speaker for today, Dr. Amjad Jarar, who will inspire us with his lecture on hydration status, health, and physical performance. Dr. Amjad, We welcome you to the second webinar series. At the end of your lecture, before we proceed with Q&A, we have Abbott Laboratories SA prepared a short presentation for us. Thank you, and we may proceed.
Thank you, Kim. Thank you so much. Thank you, Tadqeef, for inviting me for the second Nutrition and Health Symposium. And inshallah, it will be a very fruitful presentation. Let me share my slides with you first. Okay, Bismillah ar-Rahman ar-Rahim. As mentioned today, I will start my lecture about hydration responses in physiological and physical performance. Through this presentation or small workshop, we'll go through the definition of important some terminology, such as hydration, dehydration, hypohydration, in addition to discuss the visible causes of fluid loss and symptoms in adult and in children, to present some recent study related to hydration status for adolescent, and only to highlight a simple question: does we are aware about the hydration or not? Second, physiological responses to dehydration. Then we'll go through the diagnosis, the relationship between hydration and physical performance, to calculate the fluid requirement for total day and for particular physical activity. Before we start, let me start by what is mentioned in the Holy Quran. Allah subhanahu wa ta'ala قال في كتابه العزيز وجعلنا من الماء كل شيء حي أفلا يؤمنون. That's mean we create everything, every living thing in the world or in the earth made of water. Doesn't they believe that? Now let's start with the refreshment for you, to refresh you and to do some warm up for you. Let's start with what is the percentage of water in baby at birth. This is only a simple question just to refresh you and to refresh your memory. Is it 100%, 80%, 70, 65, 50%? It's simple, but a little bit confusing. We'll see. Yes, 80%. 80%, which is correct answer. Okay. This figure shows the percentage of water in the human body. At the fetus stage, the percentage of water or water made up 100% of the total body. Baby at birth create or made up 80%. When they reach to the adulthood, it will be ranged from 65 to 70%. At elderly, from 55 to 50%. When we move to the body compartment and different body tissues and cells, we found that water content in the blood reach up to 85%, in the brain 80%, in the muscles 75% to 65%, and in the cells itself reach up to 90%, which means water is essential in all the compartments of the body. And this percentage of water should be maintained and should be reached to the equilibrium, because this maintenance is very important, not only for the life, but also for the proper work of the cell itself or the organ itself. Before we start, let's go through some terminology. We'll start with the definition of hydration. Hydration is defined as a process of providing an adequate amount of water to the body tissue. Dehydration defined as a consequence of fluid loss that exceeds the fluid intake. Hypohydration, when the athletes or the subjects dehydrate themselves prior to the activity or the competition by using diuretics or by using or exposed to the high temperature, like in case of sauna. Hyponatremia, low blood sodium, which occur after prolonged sweating with failure to replace sodium and sugar when excess water also retain in the body. These are terminology very important, and we're going to use them through the presentation today. Let's start again to the second step. What are the possible causes for a fluid loss? Diarrhea, considered one of the major and the most common causes of dehydration, and is related to death. The large intestine absorbs water from the food matter, and diarrhea prevents this from happening. So the main source of water coming for the body is coming from the food itself or even the water. So when there is diarrhea, so the body, there will be an improper way to absorb the water. So there will be a stop, or let's say partial blockage for the process of absorption of the water. So the body will not able to absorb the water. That will force the body to find or to define another defense mechanism to take water from different tissues and organs. Vomiting also leads to loss of fluid and make it difficult to replace it. Sweating, the body cooling, which is considered as a body cooling mechanism. Sweating, by the way, is considered as a defense mechanism by the body. When the body starts to lose the fluid or create the sweating, mainly the aim issue for sweating just to keep the body temperature or to maintain the body temperature and to avoid the increase in the body temperature or increase the core temperature inside the body. But also in the same time, sweating also will contribute to loss of a fluid. Similarly to that, fever also can cause an increase in the sweating and might also end up with dehydration for the patient. In addition to that, diabetes also considered one of the major causes of fluid loss. How? When the blood sugar reaches up to 140 milligram to 180 milligram per deciliter, that will activate the renal threshold for glucose. So the body or the renal will start to excrete the excess glucose. In order to excrete the excess glucose, this amount of glucose should be mixed and diluted with water. So by default, once the blood glucose will reach up to 140 or 180, that will induce the body to get up from that glucose, which means excreting more fluid. So this is why I need to take it or to take it as a consideration, one of the risk factor of dehydration or fluid loss. A frequent urination also usually are caused by uncontrolled diabetes and also related to diabetes. In addition to that, alcohol intake and some other medication also may contribute to increase the fluid loss, particularly like in case of diuretics or the medication related to treat hypertension. Of course, pain considered also one of the possible causes that will cause or increase or induce the fluid loss, because that will expose the body or remove the protected area and make the water exposed and can be easily evaporated. In addition to that, these blood vessels can become damaged and causing the fluid to go out and leak to the surrounding cells. There are many simple ways to identify whether that person is dehydrated or well hydrated or not. This can be go through the physical examination. This also can be go through the laboratory test. And in physical examination, we have two methods. One method related to the color of the urine or the color, let's say, of the output, which is here the urine, or the physical examination, the appearance of the client himself. Now let's focus, let's start with the color of the urine. This is very useful tool, the color of the urine, because we use it not only with the children or with, even it can be used by adults and even particularly by athletes. If the color of the urine is categorized from or at the level of 1 to 3 on the chart, that we consider a well hydrated. However, if the color will move from 4 to 8, or the intensity of the darkness of the color of the urine will increase, that gives a strong indicator that this is a dehydration or a possible dehydration for the client. Moreover, as I said, there are other symptoms that can be used as indicator of the dehydration, which include the dry mouth, and mainly we face it during the fasting period. Also, lethargy or weakness or easily fatigued, this also can be classified as a symptoms or a cause of dehydration. Weakness in muscle, headache, and dizziness, all of these can be classified as symptoms of dehydration. In addition to that, we have some symptoms characterized by severe dehydration, which is lack of a sweating. Lack of sweating considered one of the major indicator of severe dehydration. Why? Because as I said in the beginning, sometimes the body creates a defense mechanism. Maybe that defense mechanism aimed to save water or to maintain the water content inside the body. But in addition to that, this maintenance may affect the body in a bad way, like in case of a sweating. When there is lack of sweating, the core body temperature or the body temperature increase, which is that also affect badly the body status. Lack of sweating, sunken eyes, shriveled and dry skin, low blood pressure, increase in the heart rate, and we'll talk about it later. Fever, which is mainly related to lack of sweating, because sweating, as we mentioned, is a cooling mechanism or a cooling system, and now that cooling system is not available anymore, so the body temperature will increase. Delirium and consciousness also will increase with severe dehydration. In case of children, they are not far away, but they have something particularly unique. They will form something called like sunken fontanelle, which is considered as a soft spot on the top of the head. This is usually characterized by severe dehydration for the infant, dry tongue and mouth, irritable, no tears when crying, sunken cheeks or eyes, no wet diaper for more than 3 hours. And this is considered also a very serious issue that can give the mothers or even the physician use it as an indicator of dehydration. And here we are talking about the physical examination. Okay? Now, let's move to the second question. What is the best solution to recover from severe dehydration or vomiting, and why? Energy drinks, rehydration, sport drinks, electrolyte rehydration drinks, water, 7-Up is one of the common things that used by the mothers, or apple juice also an alternative and also common things that is also used. Yes, perfect. Electrolyte rehydration drinks. Why? Because here I'm not losing only water. I'm losing water, and at the same time I'm losing high amount of electrolytes, mainly sodium, potassium chloride. So I need something to replace it. Energy drinks consider something good in terms of electrolyte, but it's almost 1/3 of the normal electrolyte of the electrolyte solution, like Pedialytes. In addition, we'll talk later about the sugar content because it will affect. Rehydration sport drinks, perfect in terms of sugar content. However, does not match the amount of electrolytes in the electrolyte drinks. It's almost 1/3. Water, perfect, and for replenishment is the best one. However, it's not enough, or the electrolyte content is not enough. 7-Up is an old practice and is not advisable. The strong apple juice, the same thing. The electrolyte content is not enough. So this figure can show me the electrolyte content for these different products. As you said here, a sport drink is different than the energy drinks. The sugar content is good. And I will talk to you later about why the sugar content is very important, even in terms of replenishment of fluid intake. Now, this is some advisable point that in case for fluid and electrolyte management, in case for infant, if the infant aged below than 1 year, the fluid intake will be from 50 to 100 ml per kilogram body weight, or as directed by the physician. And here, when I say the fluid intake, I mean the extra fluid that they need to take it, which almost equal to 50 to 75% of the fluid requirement for the infant. For children 1 to 2 years, from 50 to 100 ml per episode of diarrhea or vomiting, and may reach up to max of 1 liter over the period of 24 hours. For children aged from 2 to 9 years, again from 100 to 200 ml per episode of diarrhea or vomiting, and may reach up to 1 liter over a period of 8 to 24 hours. For adult and adolescent, the requirement require between 200 to 400 ml per episode of diarrhea or vomiting, as much as wanted by or ordered by the physician. Now, I will take you for a very small period through a tour related to the articles. As I told you before, the aim here to just check, do we drink enough water, or we are aware, or does we are aware about the hydration status of ourselves, or is there any issue about hydration? Are we reaching our optimum or not? So this is a study entitled "The Prevalence of Hypohydration in Adolescent During the School Day in Cyprus, Seasonal Variation." The aim of the study was to monitor and to measure the fluid intake and the hydration status for the adolescent boys and girls, school students, at the morning and the beginning of the study or the school day, and at the end of the school day, in addition to compare between the seasonal variation in terms of summer and winter. So 53 adolescent participants were included in the study. 39 of them were boys, with a mean age plus minus 15.1, plus minus standard deviation 15.1, plus minus 1.9 years. For sure, participants, they provided a 24-hour urine sample. In addition to that, they completed a cognitive test function mainly related or rely on the memorization and critical thinking, and on subjective feeling, whether they are thirsty or they are feeling tired or not. In addition to that, hydration status was measured by measuring the specific gravity, which is also another tool to measure the adequacy, also to measure the adequacy of hydration for the adolescent, for the study population, rather than the color of the urine. From the first figure, we can compare between four things. First thing, between the morning and the end of the school day. The second, between the seasonal winter, with a straight line with the spot on the summer. First of all, there is significant difference between them in the morning time at the level of hydration status. In the winter, the specific gravity were high compared with the summer. In addition, at the end of the day, that was maintained. If we look at the summer, there was no change in the specific gravity for the urine sample between the morning and the end of the day. However, in the winter, there was a variation or significant difference between the morning and the end of the day. Now, to go deeply inside and to explain it in more detailed way, here we'll explain the subjective feeling that were asked about, and the participants were answering this question, and during the winter and summer period. And there is the p-value at seasonal effect and the time effect. For thirsty, 3.7 or 3 points, the score was 3.7 on the morning time compared with the end day, which was a 3. The dry mouth, 3.7 compared with 3.4. Actually, there was no significant difference between them, except in the fatigue. 2.7 reported they were fatigued in the morning compared with 3.6 at the end of the school day. With water intake, it was 199 ml in the morning compared with 524 at the end of the school day. However, in the morning, in the summer period, in the morning, the thirst score was higher compared with the winter, although there was no significant difference. Although, yes, there was significant difference between them. It was 0.039. The dry mouth, it's almost the same between the morning, between both of them. the headache, the head, the numbness, the same, concentration, almost the same, fatigue. The fatigue also, there was a significant difference between them. In addition, there was significant difference, the fatigue increased at the end of the school day. For the fluid intake, there was significant difference in the beginning between the winter and the summer. However, there was no significant difference at the end. Now we'll talk about, and this is the important things here, we'll talk about the hydration status at the morning, at the end of the school day, at the two different seasons. The EU hydrated, that they well hydrated, and they have no issue with the water, only were 3 out of 53. However, slightly hydrated were 26 subjects out of 53. Very hypohydrated were 24 out of 53. So in other words, you are talking about 94% of the study population, which is about 53 of the adolescent in the winter season at the morning period were dehydrated. So only 6% of the school students were only hydrated at the morning time. At the end of the school day, if you remember in the first table, the intake was almost reached to 0.5 liter, 500 ml. EU hydrated reached up to 9%, which make up 17%. Yes, this is significant improvement, but the bad things, you still have the majority of the study population, they are still under the dehydration stages. So you are talking about a school student, they are sitting in the office or in the desk, they are doing regular physical activity or even sedentary physical activity most of the time during the school period, except if there is any physical classes, and 87 of them to 94 of them, they are dehydrated. So without going or without involving in any other factor that may induce the dehydration. On the summer, you will find 79% were dehydrated. It was significantly different compared with the winter. 11, which almost, you are talking about 21% were hydrated. At the end of the day, there was improvement. It's reached up to 29% were hydrated, but again, you are talking about 71% of the total population were dehydrated. So if I will take it as a range, I'm talking about 94 or 71 to 94% of the study population were dehydrated, and we are talking about a school student that they are, let's say they are light active, they are not exposed to any vigorous activity. This is also a continuation that shows that the significant things that from the subjective feeling was associated with them, the dry mouth, the concentration, they complain about the concentration. Also, they were tired. This is also one of the consideration that we need to take into consideration. Not only the breakfast meal only is very important, but also I believe the hydration status is also very, very important. At the end, the result here, the prevalence of hypohydration was found in both seasons ranging from 72 to 94 hypohydration, which was associated with the perception of lower concentration and alertness with p-value below than 0.05. Adolescents had a significant higher mean urine specific gravity in winter than in summer. No significant differences in water content between the season. Hydration status was not associated with the congestive function of water intake. At the end, from this study, that give us indicator that the hydration status is a very important point, even for a school student or even for any ordinary subject, even if he's not going through any vigorous physical activity or is not going through any fever or any diarrhea or any cause that will cause water loss. Because as simple as it is, we don't know when to drink water. And this is the most important things. So before going to check about the other factor that may contribute the water loss, as easy as it is, we don't drink enough water, and this is very clear from that study. This figure that can show me that how the water is reaching to the equilibrium and how the mechanism inside the body start to overcome the loss of water. As I said, food or the water is the main source of the body from outside to reabsorb or replenish the water. Once there is dehydration or even vomiting, the water intake from the intestine will be lower. So as a replacement for that, the body will use a defense mechanism, will take water from gut, from the intravascular fluid, and even from the intracellular fluid to replace the water loss. So in this case, this is how the intracellular and the extracellular fluid inside the body even lost fluid because it needs to replenish the fluid inside the intestine. We'll move to the physiological responses now, and this is a simple question. Heart rate as a response of dehydration will decrease, increase, or no change? Yes, 86 will increase. The question why? Let's go through this figure and we explain step by step. Sweating without water replacement will reduce the plasma volume, which means will reduce the blood. Reducing the blood volume or the plasma, that will end up with increase the osmolality of the blood and will increase the viscosity of the blood. As a response for the decrease of the viscosity, the decrease the plasma volume and decreasing the end diastolic filling of the heart rate will increase. So in order to increase or to cover or replenish the whole body system, the other defense mechanism will be created by the body by increasing the heartbeat. So in order to compensate the low volume of the blood here as a result of dehydration, the heartbeat will increase. So the increase of heartbeat will end up with replenishment, bigger area of the body or the body tissue or the human body. So that will add pressure to the body by increasing the heart rate. Moreover, decreasing the blood flow and decreasing the sweating rate will end up with increasing the body core temperature. And that will increase the basal metabolic, and that also will increase fatigue inside the body. Yes, we answered that question. Yes, sorry, it's my mistake. Yeah. So let's have a look at this study here. It's only I placed only the result here. We found that as a response of increasing the body temperature from 0.1 to 0.4 degrees Celsius of every is associated with 1% decrease in the body weight as water. So as my body weight reduced or by 1%, that reduction in 1% the body weight will end up with an increase in the body temperature, the body core temperature by 0.1 to 0.4%. Moreover, heart rate with a core temperature between 39 degrees Celsius and versus to 38.5 degrees Celsius, we are talking about 0.5 differences, and both of them they are reaching to the fever stage. The heartbeat varies from 194 versus 186. So actually, you are reaching to the maximum heart rate as a result of increasing the body temperature. So that can show you the importance of the fluid. And you know, with this heart rate, I can do high intensity exercise. So that can give you a 1.5 increase in the body temperature, or even 2 degrees Celsius increase in the body temperature, end up with increasing the heart rate to 194 pump per minute. Also, this figure is very important for me, especially particularly here in Emirates, that can show me the sweating rate comparing with the running speed or minutes per miles per running, compare between hot and the humidity, and cooling and dry weather. If you look at, if I'm doing physical activity or running speed at 200 or 200 meter per minute, the expected loss of fluid through the sweating range from 1 to 1.25, or almost close to 1.2. However, at the same rate, if I am under cooling and dry condition, the loss will not reach up to 0.25, which means we are talking about a 3 times difference between them. So as much as the environmental factor in terms of hot condition and the humidity will increase, that means the sweating rate will increase. And that will guide me to the situation or condition or atmosphere similar to our condition here in Emirates. We have humidity is very high, it's reaching up to 85 or 90%, particularly in Abu Dhabi, Dubai, Sharjah, Fujairah, and even the temperature easily reach to 45 or even 46. So all the factors here will contribute to increase or with increase the rate of sweating loss, which means we'll end up with more fluid loss, and that fluid loss will not only associate with water, it will be associated with water loss and electrolyte loss. Sweat is the major mean of cooling and cooling the exercising body. Loss vary greatly from person to person with different type of activity. Of course, as I mentioned here, mainly we are losing electrolytes, sodium, potassium, and calcium. This is another study. The aim of this study just to compare between the physical activity. I'm comparing 2 different types of physical activity. They have similarity in the intensity, but they are different in terms of the duration and the preparation of the players. And the preparation in terms of the hydration status. If we look at the sweating rate, here we have example A and example B. Example A, college soccer player, his weight is 60 kilogram. Example B, high school basketball, his weight 80 kilograms, so 60 and 80 kilogram. The sweating rate with the soccer player was 1.7 liter per hour, while for the basketball player, 1.2 liter per hour. The length of the activity for the soccer was 45 minutes with 2 halves, which means the duration of the physical activity was 90 minutes. However, in the basketball was 4 quarters, and each quarter with 10 minutes with total physical activity of 40 minutes. So we are comparing now 90 minutes with 40 minutes with similarity in the intensity of the exercise. Of course, they are classified as high intensity exercise, both of them. Now to number 6, the simple question, property prehydrated. Does the player wear prehydrated or not, or the player himself? No, he started with -2% body weight. He was not hydrated. The other subject, no, he was hydrated. Yes. Type of beverages, they were consuming 5 to 7% carbohydrate drinks. Mainly here we are talking about Gatorade, and the other one the same. Okay. They complete the study. The amount of water that they drink during the competition, for the soccer between the 2 halves, they drink from 700. He drank from 700 to 1,000 ml. We are talking about 0.7 to 1 liter fluid. However, for the soccer player, he drank with the total almost the same 700 ml. So the duration of the physical activity was different. There was difference in the pre-hydration status for both of the players, the basketball and the soccer. The basketball was hydrated while the soccer player was not. The duration for the soccer player was 90 minutes compared with 40 minutes. The amount of fluid intake during the game for the soccer player was between 0.7 to 1 liter, while for the basketball was 0.7 liter. At the end, the hydration status was here minus 4.8. However, here was 0, normal hydration. Here the water or the hydration status was measured by taking the weight of the players before they start the competition and at the end of the competition. So mainly the difference between both of them that can be related to the fluid lost. So here the pre-weight, exercise weight was, pre-exercise weight was 58.8, half-time 57.7, post-exercise 57. The hydrated weight was 60. As we said, he entered the exercise competition, that the soccer player with minus 2%, which he already entered the soccer game with hypohydration. However, with the basketball, he maintained 80. Even at the end of the exercise, he was 80.1. That gives me an indicator. I can maintain my fluid without any loss if I start to rehydrate myself before. And that gives me a strong indicator, or give me good ideas or strong ideas that everything can be recovered except the fluid. If I want to replenish or recover the fluid, I need to plan the recovery before the beginning of the exercise or the game or the competition. So I need to do the planning in advance before. So that player, he already started with -2 and he ended up with 4.8. And 4.8 will affect his hydration status. And we'll go through it now. We'll know how it will affect his hydration status. Before we start, let's have a look about some activity that may also contribute to the sweating rate or various sweating rate. If we look at the water polo, the rate of sweating range from 0.3 to 0.8 liter per hour. So even in they are in the water bar, they are losing from 0.3 to 0.8. Cycling from 0.3 to 1.25 liter per hour. Crickets from 0.5 to 1.4. Running from 0.5 to 1.8. Basketball from 0.7 to 1.6. Soccer from 0.7 to 0.1 liter. Rugby, which is the highest, from 1.6 to 2.6. So most of the physical activity that induce the sweat loss and induce the fluid loss. So I need to prepare myself in advance. This is one of the best study, although it's one of the oldest study, but you know why it's the best study? Because in this study, they were able to take biopsy from the muscle and from the liver, and they were able to measure many things. Part of this measurement was related to the fluid and electrolyte. This is from soccer players. They measure the glycogen and the water and the sodium content at 0 time before they start the match, and they took it after after 90 minutes at the end of the match. At the end of the match, look, they lost almost 2 liters of water, and the water loss was ranged from 1 liter to 3.5 liter of body weight in terms of water. They lost 5 grams of chloride, which is almost the requirement of sodium chloride. They lost muscle glycogen in terms from 150 to 150 grams. They lost liver glycogen 50 grams, intramuscular triglyceride 50 to 100 grams, adipose tissue 50 grams. The most important things here in this case now is the fluid and the electrolyte. So amount of the fluid they lost is very high. You are talking about 2 liters and range from 1 to 3.5 liters. Moreover, the loss of sodium chloride is not easy, and this is difficult to replace that electrolyte. I can replace part of the fluid or 80% of the fluid, but it's totally difficult for me to replace the sodium chloride if I will not take a solution that high in electrolyte. And this is the important things. This is why we mentioned in the beginning the humidity and the temperature and the effect of humidity and temperature and the fluid loss. As much I'm losing fluid, that loss of fluid is associated with loss of electrolyte. So if I will implement it here in the Arabian Gulf country, and particularly in UAE, that gives me the loss is very high in the fluid and electrolyte. Now, what is the relationship between physical activity and physical performance and dehydration? If the athlete or the subject lost about 2% of his body weight in terms of water, he will reduce from 10 to 20%, he will have a reduction from 10 to 20% in oxygen uptake. And you know, oxygen is very important and vital for the athletes, because with oxygen, I can have energy from the aerobic condition, which mainly will obtain from glycogen and even from fat. So when you reduce it by 10 to 20%, that means you will reduce the fuel efficiency for me, and you will push me somehow to go for anaerobic condition. 4% will end up with nausea, vomiting, and diarrhea. 5% will end up with 30% reduction in the oxygen uptake, and that for sure will affect badly the physical performance. 8% will end up with dizziness, difficulty in breathing, and unable to focus. Of course, more than 8% will reach up to the death, because the percentage of sodium will be the lowest, and the level of potassium will be also very high compared with the potassium, and will affect badly the heart rate and the functionality of the heart. This is a small case study. It's relatively old. I did it in 2014 for Al Jazeera players. I asked the player, drink water as much as you can and perform. And this is a normal training day. And this training only last for 45 minutes. And the only things that I emphasize them, please drink water and try to drink water before you start the exercise. Although I asked them to drink water and emphasize that, please drink water, but the percentage of dehydration as a difference in the weight before and after the competition was ranged from 1 to 3%. So I still have players that reach up to 3%. And my goal usually to be below than 2% reduction in the body weight. Because below than 2% reduction, that will make the effect of water loss with the minimal, or even it can be handled by the athletes. So even with verbal communication with the player, they didn't take the right message, or in other words, they don't know how to rehydrate well, and we'll come through it now. So, as I mentioned in the beginning, everything can be recovered except the fluid. So I need to plan the recovery of the fluid before the competition starts, before the game, before the exercise. And unfortunately, I'm focusing about the athletes, but from the previous study, we can tell even our kids, the school student, the university student also, they are not aware if they are well hydrated or not. And this is a serious issue. We have to take it into consideration, because the education and the timing of water drinking is very important, and how to plan the time to drink water. Now we start. In order, if I'm dealing with high professional athletes, I will start the recovery by 4 hours before the activity time or the exercise time. So I will start with 4 hours. I will consider it as a zero time. I will give them a fluid requirement from 5 to 7 ml per kilogram body weight. So if I have an athlete, his weight is 70 kilograms, I will give him at zero time, 4 hours before the competition, almost 350 to 500 ml of water. So you are talking about almost 0.5 liter of fluid. After 2 hours, the 2 hours before the competition, here I will give him from 3 to 5 ml body weight, and I will increase more on the electrolytes. Because here I want to retain more fluid, and also I need to plan that he will do a competition and he exposed he for sure will do an exercise and he will lose a lot of electrolyte, and I cannot replace electrolyte at the end of the competition. So I need to give him also electrolyte and the fluid during this period. Then after that, I will utilize the exercise during, we'll come to this question later. I will utilize the exercise or the activity time to give them a fluid, but the main issue of the exercise, usually we put a recommendation, or in any lecture they put a recommendation that you need, as an athlete, to drink from 50 to 150 ml every 20 to 15 minutes during the competition. This is right, but it's not realistic, or sometimes it's not visible. The athlete, they cannot do it. It's depends if the referee will allow them to do that, or they cannot even just sit and drink 150 ml. This is why I need to plan it even before. So my question here, which of the following drinks advisable to be used 4 hours before the exercise? You advise to drink water, rehydration drink, energy drink, and electrolyte drinks. And the question number 5, which of the following drinks is advisable to be used 2 hours before the competition? Water, rehydration, energy drinks, and electrolyte drinks. I think I answered one of them. Kim, are you with me? You will post the question, or there is no posting for the questions?
Hi, Dr. Amjad. It's not included in the poll questions you've given me.
Okay. In this case, I will put water for the number 4. At 0 time, I will give water. At before 2 hours, I will emphasize to give electrolytes drinks that high in electrolytes. And when I say high in electrolytes, I will not use the rehydration drink or energy drinks. I will use a formula that high in electrolytes. Example like Pedialyte is also considered a good product. And usually I use it, to be honest, in the club, but I will tell you how I use it also in different way. So during exercise, the goal of drinking during exercise is to prevent the excessive dehydration, greater than 2% of the body weight from water loss, and excessive change in the electrolyte balance. Although fluid replenishment strategies are highly individualized, athletes should aim for 3 to 8 ounces, which 90 to 140 ml of 4% to 6% electrolyte drinks every 10 to 20 minutes during the last exercise. However, as I said, this is sometimes difficult to achieve it. This is why I need to assess the fluid intake, or assess the cost of the fluid for that athlete, for this type of activity, per individual athletes, to educate the athletes that you need to replenish your fluid, or you start to do the recovery of your fluid before you start the exercise both. If remember, I told you before, the sugar is very important. This slide is not, it's not strange. You are aware about this slide. Is found in our text, it's found in the Krause and Mahan textbook for medical therapy. And for me, as a nutritionist or as a clinical dietitian, usually, and also as a sport nutritionist, I like to merge between the medical therapy and the sport nutrition, because I believe this is a good and healthy way. This figure shows me the gastric emptying rate for different drinks, according to the sugar content, not only according to the electrolyte, according to the sugar content. So if the sugar content was 0, the gastric emptying rate will be the maximum, which here in this case will be for the water. If the sugar content is 6%, the gastric emptying rate won't be significantly different than the water, which is considered also the optimum. If the drink is 8% of sugar, which also we can classify it sometimes as a rehydration drink, if the sugar is 8%, it will be significantly different. If the drink is 9%, the gastric emptying rate will be the minimum. So for me, if I want to do replenishment for the fluid, I will go for 2 choices mainly. I will go for 0 or I will go for 6% and below. This is in terms of sugar. Now, if I want to go for electrolytes, I have different options. In this case, I will have mainly two options. I will have the Rehydration sport drinks, and I will have the Pedialyte drinks. The difference between them is the electrolyte content. The Pedialyte contain more. However, the sugar content also in the hydration drink is very important, and I need it. But again, for the Pedialyte, also I think it's contained from 2 to 4% sugar, which is also considered not bad. So at the end of the exercise, I need to replenish the fluid lost. I need as much as I can to cover what I lost in terms of fluid, in terms of electrolyte. Moreover, I need to replenish the part of the glycogen. I need to replenish or to control or stop the proteolysis, which is mean the protein turnover as a result of the exercise, which will last, by the way, 48 hours also, but I need to control it a little bit. The choice, to be honest, not easy. I cannot rely, to be honest, totally on the rehydration drink or any solution only rich with electrolyte. The best things I will use, and usually what I will do in a practical setting, in the field of clubs, usually I do a mix. I mix. I'm looking at the carbohydrate content, I'm looking at the fluid content, I'm looking also at the electrolyte content. But the good things, it's much easier for me to mix a certain protein content with electrolytes. In this case, I can achieve, or if the players, they are willing to drink electrolytes like Rehydration or Pedialyte, that will be much better for me in addition to other formula they can take it later within the same time. So it depends on the choice, but anyhow, the level of electrolyte that you need to consume it at the end of the exercise, if you are doing exercise for 90 minutes, consider higher than any electrolyte level that can be provided by the rehydration drink. So rehydration drink in this case, yes, it will be an option, but it will not be a strongly option. I can go for other option for the electrolyte levels, but also in addition to that, I need to cover part of the protein and carbohydrate. And that I will leave it to you, how you can make the mixture or the right mixture. It's not difficult, but if you follow up with me, I can utilize any drink as a mixing. I can mix it with milk or with Pediasure or with Ensure. I can utilize all these products, which actually I'm using that as a recovery drink at the end of any exercise both. At the end, for the fluid requirement, there is a different formula. For adult, we are using mainly the age weight formula. This is not difficult, it's easy. If young active athletes, age from 16 to 30 years old, we will take 40 ml times the body weight. If elderly, we'll use 25 ml times the body weight. If we are talking about children, we will use the cigar method that give 100 ml per kilogram body weight for the first 10 kilograms. After that, we'll add 50 ml per kilogram for the second 10 kilograms. Beyond that, the 20 kilograms, we'll add 25 ml for each 1 kilogram. I have a small question for that. What would be the fluid requirement for a 12 years old child whose weight is 32 kilograms? 1,000 ml, 1,500, 1,800, or 1,800 ml? Okay, 57. I will not give you the answer as it is. I will solve it with you. So for the first 10 kilograms, I will give 100 ml. 100 ml times 10 will be 1 liter. add 50 ml for the second 10 kilograms will be 50 times 10 will be 500 ml. For additional beyond than the 20 kilogram, which will be here in this case 12 times 25 will be 300 ml. So the total will be 1800 ml. Perfect, Shabab. 1800 ml per day. Now, for the second question, for question number 2, as I said, there is different methods to estimate the fluid requirement. One of these methods, or the hydration status, one of these methods is to use the specific gravity. This is good in terms of I'm doing a lab work, but in terms of a practical and field work, as a sport nutritionist, that will not help you anything. You will not able to do it. And actually you will do it, but you will not benefit from it because you will tell my player is hydrated or dehydrated. No. What usually I prefer to do, a very simple method, that to take the weight of the player before the game, before the exercise boat, and after the exercise boat, and also to record the fluid that he consuming, to calculate how much he lost the fluid. So here, first step, I will calculate the fluid loss. This exercise will help you a lot, by the way, to do it in a practical way. So the pre-exercise weight is 55 kilogram. The post-exercise weight is 53.5. The volume of fluid consumed during the exercise is 1 kilogram. Exercise duration is 2 hours. How much he lost the fluid from the exercise? Let me drink some water before I have dehydration. Okay, majority 2.5 liter. Let's see. يعني 40% majority here. Okay, let's solve it together. First thing, we will calculate the fluid deficient. 55 minus 53.5. That will give me 1.5. Total sweat loss. 1.5 plus 1 kilo. 1 kilo from where? From the fluid that I took here. So the total fluid loss, yes, 2.5. If I will calculate it per hour, and the exercise boat was 2 hours, that will give me 1.25. But here we ask in general 2.5. But the question, does that mean he lost 2.5 per exercise? That you will give him only 2.5 or what? You need to put that in your mind. If I'm doing a physical activity and he's only losing 2.5 liters by this exercise per hour, I need to plan for him how to plan a diet, or sorry, how to plan a fluid replacement diet for him to cover these 2.5. Particularly, or especially these 2.5, maybe also the full fluid requirement for him. So at the end, he will have 2.5 per day and 2.5 for exercise both. So it's not easy, but believe it's not difficult because you can start by 4 hours to start the replacement of the fluid. So here I'm putting electrolytes, rehydration drinks, Pedialyte, electrolytes, and also here I'm using energy drinks. What are the difference between them? The difference between them in the composition, the content, and the sugar content, and also some differences in the electrolytes. With respect to the rehydration and energy drinks, the main difference between them is in the ergogenic aids. If that product contains caffeine, in this case, or taurine, immediately will be classified as energy drinks, regardless of the sugar content. If contain caffeine or taurine, it will be classified directly as energy drink. Energy drink, usually the sugar content above than 8%. This is why the gastric emptying rate for these products are low. So I cannot use them anyhow as a replenishment. I cannot use it to replenish a fluid. I cannot say that I'm thirsty and I'm gonna drink a soft drink with sugar content 9 to 10%. Actually, it will not solve your hydration status. However, the hydration drink, the sugar contents range from 6 to 8. We have some product 4 or 5, like Verifit is 5%, 5 to 8 is usually below than 8%. The gastric emptying rate is good. The electrolyte level are good, but it's not similar to the electrolyte drinks like Pedialyte, which is almost 3 times higher compared with the rehydration and energy drinks. And the sugar content of Pedialyte usually range from 0 to 4%, but most of the product available here from 3 to 4%, which this is why it's considered as a good tool if I want to use it as a rehydration before the competition, or even at the zero, or even during the competition time. It's advisable to be used with a rehydration drink. And I encourage even to use it after the exercise, because I need to replenish the fluid, especially in this atmosphere that like now what happened. And you know that the league will start with the coming 2 weeks, the football leagues in UAE. And this will be considered as a sport nutritionist or as a dietitian or as a nutritionist working in the field, you need to take that into consideration, because here the fluid loss will be, this is not something that it may happen. No, that will happen, and this is why you need to plan it in advance. Okay, this is the figure again. This is as an example I did for you, that for Mr. X, he will take 1.25 kilogram, and I calculate the fluid for him. I calculate because he needs at least 150 from what he lost during the exercise. So if I plan, if he's a player with me and he will lose 1.25 kilogram at the end of the exercise for 1 hour, that means he needs the fluid required by 100 ml in order to put him in the hydration status, or 0, or even above the 0 hydration status. Although I can play for between 1.25 to between 1.25 to 1.8. I can give him from 1.25 liter to 1.8 liter. But it depends on the tolerance of the player. At 0 time, which is 4 hours before the competition, I will give him 500 ml. Then I will give him, this is from 4 to 2 hours, but then from 2 to 1 hour, I will give him additional 500 ml. Here, mainly it will be electrolyte replacement fluid. Then from 0 time, which is 45 minutes before the competition, I will give him rehydration sport drink with almost 6% carbohydrate. Then during the competition, I will do my best to give him from 500 to 750 ml, especially that if I'm talking about the soccer players, they have almost 15 minutes between the 2 halves as a break, and they can drink water during this time. Of course, here I will not give him water, I will give him rehydration drink or even electrolyte drink. At the end, he can drink water and electrolyte solution. And thank you, and I hope that you benefit from this presentation. Sorry, I took you from different area to another area because I believe that dehydration is very important, and it's not only limited to fever or diarrhea, although they are one of the major contributors to dehydration in terms of children or sick patient or client. But as we noticed from the study that we are already in the dehydration stage at the school level, or even at the university level, or even us, and that can be increased and reduced by other factors like environmental factor and even the physical activity. Thank you so much. Thank you.
Thank you very much, Dr. Amjad. Before we proceed with the Q&A, we would like to proceed with a short presentation from Abbott Laboratories SA. We have with us the representative, Ms. Jinan Asami. Ms. Jinan, you can start unmuting your microphone and opening your video.
Hi, Kim. Hi, everyone. Thank you for allowing me to join you. I'll share my screen. Please let me know if you can see it. Can you see my screen, Kim?
Yes.
Okay, Perfect. First of all, I want to thank Dr. Amjad for the very informative presentation. I'd like to introduce myself. My name is Jinan Asami. I'm the Associate Product Manager for Abbott Nutrition. My presentation today won't be long, just a quick 5 minutes to kind of add on to what Dr. Amjad has already spoken about and just emphasize a little bit about Pedialyte, which is the product that we currently have in our Abbott portfolio as an oral rehydration solution for both pediatric and adults. So as you can see here on the screen, Pedialyte is available in an apple flavor. It's liquid and it comes in a 200 ml Tetra Pak. Currently in the UAE, it is included and covered by insurance. So the DDC code, I have placed it on the screen. So just a little bit of history about Pedialyte as a brand. It was the first oral electrolyte solution that was launched in the US back in 1966. Currently, it is the #1 recommended brand by US pediatricians and pharmacists and doctors, as I mentioned, not just for children, but also for adults. And we have it available in both the UAE and in Saudi Arabia in the following attributes. So it's 45 milliequivalents of sodium per liter, 35 milliequivalents of chloride per liter, 20 milliequivalents of potassium per liter, and approximately 8 milligrams of zinc per liter. So I'm not going to go into much detail about this because I think Dr. Amjad explained this very beautifully. The goal of providing Pedialyte to the consumer, whether he's a child or an adult, is really to help prevent dehydration, whether the dehydration is because of diarrhea, vomiting, exercise, or even just from heat exhaustion. As we know, in the Gulf region, just spending a little bit of time outside can cause us to sweat excessively, and this can also lead to dehydration. We have other cases such as the influenza or morning sickness that occurs with pregnancy. So whatever the reason of dehydration is, it's always recommended to use an ORS such as Pedialyte once you start seeing the first signs of diarrhea or vomiting to help reduce the severity and the further risks of dehydration. So Pedialyte contains a balance of sodium, electrolytes, sugar, and fluids to make sure that there's a quick and fast rehydration by the body. It's also 2 times more electrolytes, specifically sodium, and half the amount of sugar that's available in sports drinks, such as Gatorade that you can see in the market. And I've added this chart to really emphasize how Pedialyte is matching the recommended range of sodium and sugar as per the American Academy of Pediatrics Committee on Nutrition. When you can compare it to sports drinks, sodas, or even apple juice, you can see that the sodium to sugar ratio isn't matching the optimal levels. So that's why we really emphasize the importance of using the correct form of fluid to rehydrate the child or the adult. So as Dr. Amjad mentions, there are many different calculations needed in order to get the right amount of Pedialyte to be given or recommended to the consumer. So it's not one size fits all. Usually we recommend about 1 to 2 liters of Pedialyte per day. And it can be used for children above 1 year of age and go all the way up to adults, of course, so elderly. There's no really age limit, but we don't recommend it being used for, of course, infants or any child or infant below 1 year of age. So this is my last slide, and this is really just to show you the scientific evidence behind Pedialyte. And as you can see, you have a lot of sources, the American Academy of Pediatrics, you have the CDC, and these are all relatively recent statements. So in 2019, you have them emphasizing the use of Pedialyte, especially for children that are suffering from acute gastroenteritis. So they recommend a formula that contains 45 milliequivalents of sodium as an ORS for these adults or children that suffer from AGE or acute gastroenteritis. And they've also found that in some situations, the ORS is equivalent to an IV for cases of mild to moderate dehydration in children with acute gastroenteritis. So this is my presentation. I didn't want to take too much of your time. I just wanted to add a little bit more about Pedialyte, which Dr. Amjad mentioned throughout his presentation. And of course, if you have any questions, you can contact me or any of the representative that's currently visiting you from Abbott Nutrition. And thank you so much for allowing me to present today.
Thank you so much, Ms. Janan, for that very short and informative presentation about Pedialytes. Just wanted to confirm if there are some delegates who would like to ask about your presentation. Would it be fine to share it with them? Sorry, I think you're on mute, Ms. Janan.
Sorry about that, Kim. I was saying, please feel free to give them my email. And if they have any questions or would like the presentation, I can always get in touch with them.
Sure. Thank you so much, Ms. Janan, for that. All right, Mr. Amjad, we would like to go and address
Kim, can you hear me?
Yes, we can hear you.
Yeah, we can hear you.
Would you like to add anything, Ms. Janan?
That's it. Thank you very much.
Thank you. Mr. Amjad, we would like to proceed with addressing the questions from the Q&A. First question, since 70% of human adult is 70%, why is a bioimpedance analysis we get much smaller number like 50 or 45%? And how can we interpret it?
Yeah, this is right, but you know, you are talking about composition with a different percentage and different ratio. So when the fat compartment will increase, that means will reduce the water content. So you are talking about the end 100%. So we are talking about 70 to 65% of ideal human body that his muscle mass, or sorry, the fat, if you are talking about male, will be almost from 15 to 28 to 22%, and the fat will be from 15 to the fat will be from 15 to 22%, and you are talking about the muscle mass will be from 13 minimum and above, and the rest is coming from water. So as much as the fat will increase, the other compartment will reduce in terms of muscles, which is protein, and in terms of water. However, if the fat content will reduced, the water content will reach up to the ideal situation. So usually the hydration status or the water, we have a range. But the body composition relatively and Tanita, they are not taking the whole body. They are mainly measuring the extracellular fluid. This is why when you look inside the body, you have intracellular fluid, you have extracellular fluid. So mainly this machine, they are capable to predict the electrolyte within the extracellular fluid. And this is why it will measure. And I will tell you something related to bioelectrical impedance. Bioelectrical impedance mainly, whether it's 2 compartment or 4 compartment, mainly it's measure the water content, measure the electrolyte, because electrolyte, it has the ability to conduct electricity. So it will measure the electricity, the conductive electricity, and it will translate it into regression equation into first water content. Then it will measure the resistance of the conductivity plus the weight and the BMI of the weight of the subject. This is why there's a regression equation in this machine, and it will give you estimation. So it will give you a good estimation about the water content, but it won't be 100%. But again, it's not the total body water. It will give you mainly the extracellular fluid of the human body, even if they wrote for you total body water.
Thank you, Dr. Amjad. Is there a calculation using the weight to calculate amount of water needed daily?
Yes, mainly we depend on the weight. Yeah, if the weight and the age, because the formula mainly there's many formula. The formula rely on the body surface area and rely on the body weight. Body surface area is not easy to calculate it, and to make it easy, usually they are using on the body weight. So if I'm an adult and I'm weighing 70 kilograms, the fluid requirement will be from 25 to 30 ml. So this is easily, you will take the body weight and you will time it directly with the fluid with the amount of the fluid ml per kilogram body weight. This is
Thank
for
you, Dr.
adults. Yeah, welcome.
Is dehydration is related to high urea?
Dehydration related to high urea. Actually, high urea can be used as an indicator if there is dehydration. Because in normal pathway, urea is a toxic product. And if the renal is working well, the renal will excrete that high amount of urea. But if the urea will be high, yes, we use it as an indicator of dehydration. In addition, it will give you a possible indicator of malfunction of the liver. So this is why he need to check the liver, and he also to check the renal, because if urea is high and there is nothing with the renal, that will give me an indicator that there is a dehydration. And usually this is the first step when we are looking at any lab result from the hospital. We check the electrolyte levels and we check the blood urea nitrogen also. If it is high, that will give me an indicator there is a dehydration if there is no anything with renal and anything with liver.
For a patient on dialysis, can we recommend a fluid rehydration protocol same as normal patient?
No. And the dialysis is different little bit. This is why in dialysis, first of all, you need to know exactly what is the dry weight. So this is why you will do estimation. Usually the dietitian in charge about the renal and even the physician will put a recommendation as they will put as a ceiling. Ceiling, that means that the patient should not increase or go beyond 1 liter or sometimes 1.5 per liter. Yes, with dialysis, it will be much easier because they are doing dialysis and they're removing the extra fluid, but also usually they calculate it, but we cannot use the same way. It cannot be used. We usually put ceiling that I need the ceiling of 1 liter or 1.5 liter maximum per day. But usually in a practical, we determine the amount of, if the patient is if the patient is doing dialysis 3 times per week and he doesn't have issue with over fluid, too much issue, usually they give him more flexibility, but he will not go drink water as much as he can. So usually they call it not fluid requirement. They call it as ceiling of fluid. This is the maximum ceiling of fluid. They should not go beyond it, 1 or 1.5 liters.
Thank you, Dr. Amjad. Is juice good for dehydration?
Now it depends. If you are talking about the fluid, yes. But you need to be careful about now which sugar and juices. Because if the sugar, now the sugar content usually in apple juices range from 9 to 13%. So the gastric emptying rate will be low. So it won't be useful. So if I'm aiming to replenish a fluid, I will not achieve it. If only just a fluid and I don't have severe dehydration, it can help. But what is the best than in case of dehydration? The best thing that I can take rehydration drink. I can take like Pedialyte, or even I can use, I would say, rehydration sport drink, or any drink with low sugar with electrolytes. But with severe dehydration, the choice and the best choice will be the Pedialyte. Not because this activity is sponsored or we have guests from Abbott, but no. Now in the club, Al Jazeera Club, I'm using Pedialyte. I'm using it after the exercise because especially with this atmosphere, the Gatorade or let's say the rehydration sport drink won't be enough.
Thank you, Dr. Amjad. How antihistamine and antipsychotic cause fluid loss?
Well, I need to search about it. If they want, I can search about it more and more. I can search about it and answer, but let me give me a clear, comprehensive question. But I cannot answer it like this. I need to look at it.
Thank you, Dr. Amjad.
Okay.
So before exercise, water is enough?
No, this is not fair. Allow me to say that because you cannot take it as it is. We are not talking. There is many factors. You need to look at the type of exercise. You need to look at the intensity of the exercise, the duration, the environmental factor, the temperature, the heat. You are talking about professionals or you are talking about yourself. If I'm talking about myself, I will do exercise, let's say less than 1 hour, 45 minutes. Yes, for sure. For me, water is more than enough. But if I'm talking about a professional athletes or even someone will do, even me, if I will do exercise under hot climate and humidity like this, no, I need the electrolyte, because the first thing that after you finish the exercise, you start to feel muscle cramps. These muscle cramps as a result of electrolyte imbalance and the loss of the fluid. So you cannot, sorry to say that these are very general question, this question, because the exercise now is very specific. Even if you ask me about the type of snack that you need to give it before exercise, I will ask you, you need to give me more information about the exercise, more information about the intensity, about the duration, about everything.
Thank you, Dr. Amjad. Do breastfeed infants like 4 to 6 months need to be given water? If yes, how much?
Usually they take sips of water, but usually the fluid, because in this is easy. You can use, we use usually the RDA for fluid requirement. This can be found easily in the textbook, but I remember it's 120 ml per kilogram body weight. But because if you look at the milk, you are talking about milk, almost 95% of the milk is a fluid and water. So most of the fluid and water will come from the milk. Because in the beginning, they will rely totally on the milk. So most of the 95% of water will cover from the milk itself.
Thank you, Dr. Amjad. What is recommended fluids intake for adult obese patient with weight like 120 kg?
This is very good question. Now, I will answer you in this way. The fluid requirement rely on the body surface area and rely on the weight. So as much as he weight, you need to give him a fluid. So I can give him from 25 times the body weight. This is my son. Time the body weight. So you will take the actual body weight of even if he's obese, you will time it with the fluid requirement for adult 25. Even if he's obese, you will not use the adjusted or the ideal body weight. If he's healthy, okay? Healthy in terms he doesn't have issue with the renal or anything, you will use the actual body weight. Yes, Kim.
During soccer game, what kind of drinks is the best to give the players and how much in ml is maximum?
Good. This is very, very good question. Usually, as I told you, we plan the fluid requirement for the players, most of the players before. Usually, from my experience, they can tolerate to drink from 350 ml to 500 ml. The best drink that usually we provide them with Gatorade, Rehydration sport drink. Now also some of the players, they have Pedialyte, but as I told you, they need to test it before. But usually I give them permission for these two types of drinks. They can take Gatorade. I'm not here promoting any company. They can take Gatorade, they can take Virofet, even Isostar, good, not bad. Even Pedialyte, they can take it. Now the sugar content is good. You are talking about range from 4 to 6 to 7%. So that will make me feel more comfortable that they will do replenishment very fast. In addition to the electrolyte is good. Yes.
Which electrolyte is good for 4-month-old baby?
It's depend on the case. If they lost sodium, most of the electrolyte, what are the electrolytes? You are talking about sodium, potassium, and the chloride. If there is a loss, we are not promoting to give electrolyte just like this. But if there is a cause that will cause a fluid loss and electrolyte loss, in this case, yes, it is recommended to give them fluid replenishment and electrolyte. Because as we noticed from the previous studies, usually the loss of the fluid is associated with the loss of electrolyte. So it's not the choice which one, because you are talking about the same electrolyte. It has, it's the same content. You are talking about sodium, potassium, and the chloride. These are the most important. Yes, some product they are putting magnesium, other, but the most important is the sodium and potassium and chloride.
Thank you. Can we prepare hydration liquid by adding 1 teaspoon sugar to 1 cup of water and sprinkle of salt for kids for hydration at home if they have diarrhea?
This is, I'll be very frank with you. This was an old practice, not was limited for the kids with diarrhea, even was in the sport fields. But unfortunately, you need to make sure exactly about the content. So I cannot tell you yes or no, because that will affect, you need to talk about the volume. You need to mention the volume. You need to make sure about everything, the quantity. But from my experience, the electrolytes, replenishment drinks are available and it's not expensive. And the good things that even for kids, it is flavored. So sometimes I will not only just prepare something and I will not give it for it's not be tasty. I think also we need to take into consideration the flavor. So these electrolytes are available and it's not expensive and can be prepared. In the past, yes, there is, I'm not talking about the infant. I'm talking about the athletes that some old school until now they are preparing these, but it's not advisable because due to the contamination issue, the hygiene issue, it won't be safe unless you need to be more safe, because if there is dehydration with the infant, maybe, or the child, maybe that as a result of any contamination or any fever. So maybe if that water is not clean enough, or is not hygiene, or is not, let's say, in other words, pasteurized water, maybe it will cause a problem more than the issue of dehydration.
Thank you, Dr. Amjad. The next question, I think Ms. Jinan from Abbott would be the best one to answer.
Yeah.
Ms. Jinan, there is a question asking what is the age to best start Pedialyte?
Yes, thanks, Kim. So Pedialyte can be used from 1 year old to, adulthood. So even 70-year-olds can benefit from Pedialyte. As Dr. Amjad mentioned, it depends on the calculation and how much they need from the rehydration fluid, but it is safe to use for children 1 year of age.
Thank you, Ms. Jinan. Dr. Amjad, what is the healthy food for patients who have a problem in their leg and can't walk?
Can you repeat the question, Kim, please?
What is the healthy food for patients who have problem in their leg and can't walk?
This is not related to the presentation. Now it will, listen, you need to put the age of the baby or the child, and they can take any healthy diet like any normal child. So if they cannot walk, that will be, there is different reason for not able to walk. Is it that something related to physiological issue, or that related to psychological issue, or that's as a genetic factor that from that family, they took more time until they walk. So I need more specification about the age, but there is nothing will say it will claim that it will promote the walking. No. If I am providing a healthy diet for the child, that means it will be well-balanced diet in terms of macro and micronutrient, and that will be enough for them to give them enough calorie, enough protein, enough micronutrient in terms of vitamins and minerals to support the growth of that infant, or even the walking or any activity. But usually the walking is there is multiple factors. Is there any muscle atrophy on that child? Something like this. Or sometimes it's psychologically more than anything else.
Thank you, Dr. Amjad. Almost 80% of SMM is water. how can we interpret the SMM if it is actually protein or fluid retention, since those who will have high fluids would have high SMM?
He's or she's referring to the bioelectrical impedance. And I will be very frank with you. These are very good machines. It's give me very good information, but it depends how you utilize this information. I cannot utilize, this is my point of view. Allow me to say it. I cannot claim 100% that will be extra fluid, or this I can use it to detect the muscle mass. For me, as a sport nutritionist, I need to look at the fat. The fat is good, although I will combine between the bioelectrical impedance and I prefer to use the caliber. I look at the total muscle mass area from the machine, but I don't go through the breakdown because the breakdown will be affected by the water content. So if you look at the result of any client you have, and you look if there is a difference in the fat, immediately you will find a difference in the water content. If there is a difference in the water, by default you will find difference on the protein. So I cannot rely 100% on the protein. Yes, it can be helpful for me if I'm comparing the extracellular fluid with the intracellular fluid. It can give me a hint or an indicator. But again, I cannot rely on it 100% without checking the electrolyte on the blood. So this is the difference. But I will give you a good indicator. As a nutritionist, as a dietitian, in a clinical setting, what is the best tool you are using to measure the muscle mass? Usually we are taking what? The mid-arm circumference. And we connected or we compare it with the triceps. So I can calculate the mid-arm body circumference, and I can calculate the corrected mid-upper arm circumference, and I can check it easily by the percentile on the growth chart. If you check Niemann or Gibson at the end, you will find all the mid-upper arm corrected mid-upper arm muscle circumference, and it will give you the percentile. And from this percentile, easily, you can tell that my client or my athlete is wasting or under or below the protein average, or within the range of the protein average, or even above. That, believe me, this is what I'm using here with the players, and it's very helpful for me, to be honest, because I can easily detect if any player is losing fat and he's losing muscle and he's reaching to the below average or the wasting area. I'll report the head of the medical unit, and I will tell him that the player is easily susceptible to have injury, and by default, he will have injury later. This is why we can use it to reduce the training intensity and the duration for these players. This is, believe me, much better. The bioelectrical is perfect, but perfect in terms how I want to use it. Yes, there is other fancy calculation is good, but it's not easy. But now there are some studies about it is going on, but still, it's need a lot of time to be clear. Yeah.
Thank you very much, Dr. Amjad, for that wonderful presentation. I know you are very busy and we will not take most of your time. There's the remaining questions, but we could, for those who have still some clarifications and questions, you can send us an email and we can forward it to Dr. Amjad for any further answers. Before we end, Dr. Amjad, would you like to add anything to our participants?
Thank you, participant. Thank you for your trust. Thank you for attendance. And I want just to remind you by a small thing. Remember, you are nutritionist, you are a dietitian. Utilize your background in clinical nutrition. Believe me, if you utilize it very well, you can be a perfect in sport and nutrition in any field you want. Always, whatever you will take, go and study it again and again, and do not only just copy, go and check. If you look at the supplement, the nutritional supplement that are available in the market, most of these supplements was designed before, not for the athletes, was designed for patients under stress condition like in burns, like in cancer. but they took the similarity and they connected with the athletes. Now, like the body composition, as most of you question, I have something unique. I can do it as a sport nutritionist, which I can utilize the caliber. I can utilize the mid-upper arm circumference, which actually is used even in the clinical setting. I can utilize it. I have all the references. I can use it in the field also. So thank you so much, Tatqif. Thank you for giving me this chance to interact with a big group of professionals. And I learned from them, and actually I'm enjoying even your lectures, especially yesterday lecture, or sorry, Thursday lecture about the gastric sleeve. Thank you so much. Thank you so much.
Thank you so much, Dr. Amjad, and it was also a pleasure to work with you. And we have a very good comments from the attendees. It was very useful, very informative, very interesting topic, and we look forward to always collaborate with you in the upcoming activities.
Inshallah, inshallah. Thank you so much. Thank you.
Before we end, once again, on behalf of the TAKIF Health Treatment Undertaking Services and Professor Aisha Al-Dahiri, the Chair of NHS 2020 Webinar Series, we would like to thank you all attendees who have stayed with us until the end of the course, and to Abbott Laboratories SA, our NHS partner for today. Please be reminded that our course attendance was monitored, and for the number of minutes that the attendees were connected to calculate the CME hours you will be receiving. Once we have gathered and finalized all attendees' minutes of attendance, you will receive an email from us with 2 links, post-test and evaluation as a prerequisite of DOH. For those who will complete both links, we will send within 10 working days the copy of your PDF certificate along with the PDF format of the presentation of today's course. Please note that the online post-test and evaluation portal will only be open for 1 month from the date of the course. So please make sure that for those who are able to attend, to fill out both forms to get your certificate. We would like also to kindly invite everyone to please follow, like, subscribe our social media accounts, Facebook, Twitter, Instagram, LinkedIn, and YouTube under TAKIF Health Treatment Undertaking Services to receive the announcement of our upcoming courses, as well as view the recorded previous sessions. With that, for those who are unable to join today, we are simultaneously live to our YouTube and Facebook account, which will be open for weeks. We would like also to take this opportunity to invite you to our next 2 webinar series in partnership with Nestle Health Science and TAKIF. You may view the schedule and flyer through our TAKIF website and Instagram account. Once again, attendees, Dr. Amjad, thank you so much, and to Abbott Laboratories SA, Ms. Janan Asami, for staying with us. And we hope to see you in our future upcoming activities. Stay safe, everyone.
Thank you, Ken. Thank you.